Why don't you pop into the chat where you're joining us from tonight or this afternoon, because I'm in Vancouver, so it's 4 o'clock for me, so it's afternoon, and I know Dr. Scully is back east, so it's evening for her, and Mallory is in Ontario, so it's evening for her as well. So let us know where you're joining us from as you get yourself settled and grab a glass of water or something to drink, and we'll get started in about 1 minute. Hello, Lorna from Calgary. Dr. Scully from St. John's. Hi, Diane from Milton. Chatham. Greetings from Pennsylvania. Hello, Mary. Elaine's in Ottawa. Elise is in Cornwall. Tina is in BC. Hello. St. Paul, Alberta. Another on Ottawa, Edmonton, Montreal, Ottawa. I feel like I'm seeing some names that I saw. Hello, Lisa's in Vancouver. I feel like I'm seeing some names that I saw on some of the other webinars. So if you're joining us for another webinar, thank you for coming back. Thank you for coming to listen to another one. Oh, hi, Leah. Nice to meet you on Monday as well. Wonderful. Thanks for coming tonight. Okay, our minute is up. Let's get ourselves rolling here. So I'm going to start by sharing my screen here quickly, and then we'll go through some of the kind of the housekeeping before we get started onto our presentations. Okay, I think everybody can see my screen now, but I've got to find out where my presentation, it's underneath this. Sorry, everybody, slideshow. Okay, so welcome to tonight's Health at Home webinar. Tonight, we're going to be discussing iron deficiency anemia and celiac disease. So I sure hope that's the one that everybody thought they signed up for. Tonight's webinar is generously sponsored by Shar. Shar's got some delicious new products out. One of them, which my daughter actually tried on Monday night, was their twin bar. And she said, Mom, it tastes just like a Kit Kat. You know, her 7-year ago, that memory of what a Kit Kat tasted like, but she thinks it tastes just like a Kit Kat. So I'm gonna have to try it because I do love that. So it sounds absolutely delicious. So I'm gonna have to try that. So go find your new Shar products. And tonight Shar has kindly donated a $50 prize giveaway, and we're going to be revealing the name of that lucky winner at the end of the webinar. So hold tight for that. We're just going to get started with a couple of poll questions to engage everybody. So we're going to start with our first one. And I'm just Melissa's going to pop it up for me. Okay, so tonight you're here. So why are you, what are you, not why are you here, but what is your status? Do you have celiac disease, biopsy diagnosed, celiac disease suspected, gluten sensitive, family member or caregiver, medical professional coming for some insight from Dr. Scully, wondering if it could be celiac. You have symptoms, but not yet a diagnosis. You're still on kind of that journey of questioning whether or not it is celiac. So let us know where you fit in that. And you could be a parent and caregiver and have a child with celiac disease and have celiac disease yourself. So pick one of the categories and we'll see where we land up here. So 70% so far are biopsy diagnosed celiac. Interesting. Parent or caregivers, 12%, suspected celiac, 13%.
Nicole, we've also got, just so I cut in here on the, we've also got people also simultaneously answering question 2, which is I suffer from the following symptoms.
Okay, sorry, perfect.
So they're selecting all that applies. So you're going to get both results shortly. So
at the same time. Okay, so the second question, I suffer from the following symptoms, select all that apply. Okay, so this one's really interesting and very relevant for our topic tonight. So low energy fatigue, 91%, dizzy spells, 36%. Fast heartbeat, menstrual issues, feeling cold a lot, 50%, hair loss, 33%. These are really interesting stats for us to look at. So thank you, everybody. Dizzy spells are, definitely related to iron deficiency, and it's also a neurological complication of celiac disease as well. So that kind of covers two different categories. Okay, so as most people, looks like things have stopped. So we're looking at low energy at 91% as our number one, and celiac diagnosed biopsy 61%. So thank you guys for filling out those polls. And for those who are at 7%, could it be celiac? I sure hope that we help you out tonight. And if you do have further questions for Could It Be Celiac, you can always email our client support desk at info@celiac.ca, and we're happy to help you navigate how to officially come up with that diagnosis. Okay, so next slide. This is our client support desk that I was just talking about. So you can either speak to myself. I'm a registered dietitian. We can hook you up with, we've got a few peer supporters we can get you to talk to. You can talk to Kaylee McCauley. She's one of she's on our client support desk as well. We're open from Monday to Thursday, 9 to 4:30 Eastern time. There's that email, info@celiac.ca, and the phone number for you to reach us at. So this is a wonderful service for those who are looking for some support. And of course, we are a charity and we are always looking for donations, because without donations, we can't do all of this work and helping to empower people and helping to inform our community and really advocating for moving forward on all kinds of things. One of the topics actually tonight I'm going to be talking to you about a little bit is fortification and food. So we are constantly talking with Health Canada and the CFIA, trying to get equal treatment for people with celiac disease. So we can't do that without your donations. So please do consider donating this Celiac Awareness Month. There's a few more upcoming events. We're halfway through Celiac Awareness Month, but we still do have next Wednesday, our final webinar Wednesday is mental health and celiac disease. And then on the Saturday, it's a cook along with me. So we're making Southwest veggie tortilla wraps. And really, this is a really interactive session that we can chat and we can ask questions and we can talk about cooking techniques. Mohammed, the rep for Promise Gluten Free, will be there, so you can make, ask him questions. It's a really nice interactive session. So please do join for that. We do have a max capacity of that at 50, and we're already over 30. So if you're thinking about it, please do sign up soon. Okay, so housekeeping, how does our webinar work? Everybody is going to be on mute tonight. If you have a question, please put it in the official Q&A box. I mentioned earlier to put where you're from in the chat box. The chat's an informal area to kind of chat with one another. The Q&A box is what we're going to be looking for those questions for Dr. Scully. So when else do you get an opportunity to ask a hematologist questions? Tonight. Tonight is the chance. So please write those in the Q&A. I always say when we have somebody as with such an expertise as Dr. Scully, why wouldn't we come and ask her questions? It's so fantastic. So this session is being recorded and a copy of the webinar presentation will be emailed to you in the next few days. So watch out for that in your inbox. Okay, that will be it for my housekeeping. I am going to get out of screen sharing for a second. And I'm going to welcome our two panelists tonight. So thank you, Mallory. Mallory Bolton is a fourth-year student studying engineering and chemistry at Queen's University. And Mallory is also she's here tonight to share her own personal journey with iron deficiency anemia and celiac disease. So I'm thrilled to have you here tonight, Mallory. Thank you so much for joining us. And then we also have our hematologist, Dr. Scully. And Dr. Scully graduated from medical school at the University College Dublin in 1979. Her education and career has taken her to the University and Trinity College in Dublin, Gaddon, Sharstay, Norling Monastery in Mungud, India, the University of Toronto, Queen's, and McGill University in Montreal. Between 1991 and 1997, Dr. Scully worked as a pediatric hematologist and oncologist in St. John, New Brunswick. And between 1997 and 2016, she worked as an adult hematologist and oncologist at the Health Sciences Center and as an associate professor at Memorial University. Today, Dr. Scully works as a part-time clinician with non-urgent benign hematology patients. So that's quite an expertise. So thank you so much, Dr. Scully, for taking the time out of your busy schedule and coming to share it with us tonight. We really appreciate it. And I am Nicole Byram. I'm the Dietitian and Health Promotions Manager with the Canadian Celiac Association. And I'm going to be giving your presentation tonight. So Dr. Scully is here for our questions. So I'm going to leave her lots of time. So my presentation is going to be on iron deficiency anemia. So you learn what it is, how we can treat it, and then we get a chance to really spend some time asking Dr. Scully those questions. So I'm going to tee up my presentation and then I'm going to share my screen with everybody. Okay, And I see those questions are rolling in already. Okay, Let me see here. Sorry, everybody. Let me just get slideshow from the beginning. Okay, and I'm going to move this. Okay, I'm going to move my panel of people here. Okay, so thank you everyone for attending our iron deficiency and anemia discussion. Let's get rolling. Did you know that the World Health Organization states that if the prevalence of anemia is greater than 40% in a population, it is considered a severe health problem? Well, you'll learn tonight the percentage of people with iron deficiency anemia in the celiac population is greater than this number, and I'll tell you by how much. In a survey done by the Canadian Celiac Association from 2009 to 2011, it was discovered that 67.8% of people with celiac disease have iron deficiency anemia. This to me is a staggering number, and this does qualify as a severe health population for our community. A severe health problem, for our community. So let's chat a little bit more about the roles of iron in our body and food sources of iron in the context of the gluten-free diet. Okay, so a little bit of just an intro on what celiac disease is, in case, for those people wondering if it could be celiac disease. So as many of you know, celiac disease is an autoimmune disease. It's not an allergy, as many people may think. This is a common misconception by the broader community. When you have celiac disease, gluten ingestion damages the small intestinal mucosa and reduces the gut's ability to absorb nutrients, including iron. You can see on the right-hand side, this image, the difference between the normal gut and the gut damaged by celiac disease. There's a lot less surface area for nutrient absorption. So that reduction in surface area reduces the amount of iron that you could obtain from your diet. What does iron do for the body? Iron is a very important nutrient because it carries oxygen in the blood and helps with neurological and physical functioning, respiration, growth and reproduction, and energy production. Iron is the core component of hemoglobin, which binds oxygen and carries it throughout the body. 65% of iron is attached to hemoglobin, 25% is attached to ferritin, and 10% is found in muscle tissues and other cells. Where do we find iron in our diet? So there are two types of iron that we like to talk about. There's heme iron and non-heme iron. Heme iron is typically found in animal products, where non-heme iron is found more in plant sources. Heme iron is known for its higher bioavailability, which means it absorbs more easily in the body. However, non-heme iron, when paired with a vitamin C source, can help to increase its absorption. There are some foods that may hinder the absorption of iron. These include calcium-rich dairy products, phytates in nuts, and oxalates in spinach. Here are some good sources of both heme and non-heme iron. And on the right, you can see some sources of vitamin C that you can pair to increase the overall absorption. So you can see vitamin C sources tend to be fresh fruits and vegetables. Let's look a little closer at the daily requirements of iron before we take a look at a few more specific food sources. So the average female between the ages of 19 and 50, so this is premenopausal, require 18 milligrams of iron daily. During pregnancy, this increases. For men of the same age, their requirements are lower. What are some signs and symptoms of iron deficiency anemia? Some common symptoms include fatigue, hair loss, weakness, irritability, abnormal heart rate, shortness of breath, pale skin, feeling cold, and dizziness. Now let's look a little bit closer. Now that we know that we need 18 milligrams of iron daily for premenopausal women between the ages of 19 and 50, let's look a little more closer at some examples of iron sources. Here are some specific heme iron examples. You can see up on the left, duck being 4.3 milligrams per 95 grams is the highest. And then we go down, the lowest is on the other end. So for example, something common that you might have for dinner, a chicken leg, 0.7 milligrams per 2.5 ounces. Beef, 2.1 milligrams per 2.5 ounces. Now let's take a closer look at non-heme iron sources. So for people who are vegetarian, for example, this is where they're going to obtain most of their iron sources. So again, we can pair it with a vitamin C source, and this will increase its absorption or its bioavailability. And here you can see things like a potato, about 3 medium potatoes, 4.5 milligrams of iron. Tofu is about 2.1 milligrams. Lentils, 3.5, they're a great source of iron. Chia or pumpkin seeds, 2 to 3 milligrams depending. Hummus is another good source. Eggs are actually a non-heme iron source, so that's 0.7. And remembering that the iron for eggs is found in the yolk, the protein is found in the white, so eat the whole thing to get the benefits of both. Now let's discuss the stages of iron deficiency. So you might have heard of you're iron deficient or you're actually anemic. So let's kind of tease that out and figure out the differences there. Many of you have had your blood levels taken and may wonder what they actually mean. So clinical iron deficiency anemia is when iron stores are depleted and hemoglobin levels drop. So for somebody, for example, with a hemoglobin of 97, that is low. So that would be clinically considered iron deficiency anemia. A marginal deficiency is when you have low transferrin levels, and a mild deficiency is when you have your serum ferritin levels are low. So, for example, my daughter just got blood work done, and her ferritin levels are low. So I know that the depletion is of her iron stores. So when you're told that your ferritin is low, that's a mild deficiency. It means that your iron stores are low. So who's at risk for iron deficiency anemia? So here's the list of people. So those who menstruate, people who are pregnant or breastfeeding, vegetarians and vegans, and people with celiac disease. So we know that people with celiac disease are at increased risk because of that mucosal damage from the slide you saw before. The nutrient absorption is so low that it causes these deficiencies. And we know that 67.8% of those newly diagnosed are presenting with a deficiency. This slide demonstrates the need for early screening in those with iron deficiency anemia. Here we see that 67.8% of people with celiac disease have iron deficiency, and in turn, 11% of people with iron deficiency anemia have celiac disease. So when we think about 1% of Canadians have celiac disease, if this population is showing us that 11% have celiac disease, this is an indication for celiac screening if you present with iron deficiency anemia. And once somebody is on a strict gluten-free diet, the intestinal mucosa begins to heal. Once healing begins, iron absorption will increase. However, healing can take upwards of 2 years for many adults diagnosed with celiac disease. And some studies show us that many Canadians, approximately 28%, still do persist with anemia after following a gluten-free diet for more than a year. In these cases, supplementation may be required. Once on a gluten-free diet, it is recommended to regularly incorporate iron-rich foods. We discussed some of these food options earlier, but many people ask about prepackaged and processed foods. Are they not fortified in Canada? Is there not a way that I can get my iron sources from mandatory fortification regulations here in Canada? Well, let's take a closer look at that question. These are the current mandatory fortification standards for gluten-containing flours in Canada. So as you can see, here in Canada, regular gluten-containing flour must be fortified with thiamine, riboflavin, niacin, folic acid, and iron. Now, by proxy, anything made with these flours will also be fortified. So if you're eating regular crackers, regular pasta, regular bread, regular cereal, that will also be fortified because it's being made with this flour. As an example of how fortification is a huge public health success, folic acid was the most recent addition to this mandatory fortification. That was in 1998. When folic acid was introduced, rates of neural tube defects dropped by 50%. So that's by all accounts, an enormous public health success. So we know that fortifications work. In a 2018 study, the nutritional quality of gluten-free items compared to their gluten-containing equivalents were examined. So this is really fascinating. It was found that bread, cereals, flours, and pastas were 55% lower in iron, 44% lower in folate, and 36% lower in protein. So let's take a closer look at Canada's fortification standards and why this might be. So as you can see here, as per Health Canada, white flour, enriched flour, or enriched white flour should contain 4.4 milligrams of iron per 100 grams. So this is for regular gluten-containing flour. However, this mandatory fortification does not apply to gluten-free food items. When an item is gluten-free, fortification is voluntary. So it is no longer mandatory, it is now voluntary. If you know that the #1 food source of iron in Canada is iron-fortified breakfast cereals. So many of our children eat breakfast cereals, so many adults eat breakfast cereals, but only 5% of gluten-free products are fortified with iron. So that #1 iron source for most Canadians does not translate to those in the gluten-free community, which is very disappointing. Here's another example. So this is a gluten-containing flour, and as you can see, this one is fortified with iron, thiamine, riboflavin, niacin, and folate. And in this per quarter cup, there's 2 milligrams of iron due to fortification regulations. Same company, same serving size, but it's gluten-free, 0 iron, and none of the other fortifications either. So, you know, as a mother of a daughter with celiac disease, this gets a little bit scary. Here are some cross comparisons for regularly fortified foods versus our gluten-free counterparts. So crackers to crackers, bread to bread, pretzels to pretzels, cake to cake. As you can see, the percentage of fortification or the percentage of iron in each product is much lower in the gluten-free side. And finally, let's take a look at the day in the life of somebody with celiac disease. So this diet is based on a simple diet, lower in whole foods, however, quite representative of many Canadians. As you can see, the gluten-containing day meets the daily requirements of 18 milligrams of iron. So just through having cornflakes, white bread, crackers, spaghetti, and some Oreo cookies. Because of fortification, this person is getting their daily iron requirements, so they're being taken care of. The same counterpart in the gluten-free community, and you guys are covering, I think it's 3.4 milligrams of iron, which is only about 18% of our daily needs. So as you can see, iron deficiency anemia is very, very common in the celiac population. And once you go on a gluten-free diet, there are barriers with lack of fortification standards that help our community to increase these levels. Now, I don't want everybody to feel scared and terrified, because as we talked about earlier on, there are lots of gluten-free items that are good sources of iron. They're just found in more of a whole foods diet. So we don't have the ability to rely on those more processed foods. We have to eat more of the whole foods to make sure that we get enough iron. So it's really good if you remember to have that touch base with your dietitian to talk about, am I meeting my iron needs? Have that conversation with your doctor. How are my iron levels doing? What can I do to increase them? So it's just something as people with celiac disease that we need to keep on our radar as something to be aware of. When you're mindful of something, we can have a lot of prevention. So thank you so much. I didn't go too long, Dr. Scully, because I wanted to leave time for you. So I appreciate everybody listening, and I'll pass it over to the group for some questions. So I'm going to stop sharing my screen, and we'll get right into the questions. Ooh, I saw somebody from Argentina. Yay. Okay, so Dr. Scully, do you want to take yourself off mute? Perfect. Oh, Mallory. Sorry, let's let Mallory share her story.
That's okay.
Now that we've gone through all of this, Mallory, I'm so sorry, Dr. Scully.
That's good.
Let's pass the torch on to Mallory, and she can share her story with us tonight.
Okay, yeah, so I'm just going to quickly share my story with how I was diagnosed with celiac disease. So for some background, I was diagnosed 5 years ago with celiac disease when I was in grade 11. And at the time, I was a competitive athlete in high school, and I was doing well in my athletics. And then after taking a few months off for the summer, I came back, and all of a sudden my performance had just dropped to 0. I was the worst on the team. I had been one of the best, and I was very confused of what was going on. I was feeling tired, but I dismissed it as kind of, you're in school, you're working hard. So I kept trying at practice, but after a few weeks, I couldn't really deal with it anymore. My hairdresser actually told me as well that I was having some hair loss, which I kind of dismissed, but kept in the back of my mind. And actually, I guess the kind of turning point for me was one day I was sitting in class after my rowing practice in the morning, and my heart was racing. And I told my teacher, because I had a sport watch on, I told my teacher that my heart was around like 140 beats per minute, even though I was just sitting there. And she actually called, her mother happened to be a doctor, and she thought I was having heart complications. So she called her mom. But after that point, I decided I should see my doctor. And she carried out kind of standard blood tests for a variety of issues. And what she found was that my iron was almost 0, and I had low hemoglobin as well. So I was anemic, which isn't abnormal for a teenage girl. So I started taking iron supplements for a few weeks, about a month, and then I returned to have repeat blood work. And this is kind of where we hit a bit of a roadblock, because upon the repeat blood work, the situation hadn't improved at all. I had stopped exercising for the month as well, so I could try and increase my iron stores as quickly as possible, but obviously there was something wrong. So for about another month, I just continued taking heme iron supplements twice a day. I was taking I was taking vitamin C, as Nicole talked about, that helps with your absorption. I wasn't drinking any milk to avoid calcium. And then we didn't really know what was going on. I had a bunch of repeat blood tests, still no improvement. And then I was actually lucky enough, one day my doctor called me out of the blue and said, I want you to get this blood test for celiac disease. She didn't think the chance was very high that I had it, because I didn't have any gastrointestinal symptoms. I didn't know of anyone in my family with celiac disease, but she thought it was something that we could just cross off the list and look for other issues. And it actually turned out that when I got my blood test, my TTG, or the blood test, was off the charts high. So I went for a biopsy as soon as possible, came back positive for celiac disease, and I've been gluten-free ever since. So yeah, after that, my iron improved a little bit. I do still struggle a little bit with anemia and iron deficiency, but I take supplements regularly, so that has kind of helped mitigate the issue. And yeah, my whole family had to get tested as well after I was tested positive. And my dad actually also has celiac disease, despite having no symptoms at all. He's not anemic, he doesn't have any symptoms. So that's my story. Really, anemia was the only tip off for me, but I'm very thankful that I was able to figure out what the issue was, and there is a solution to follow a gluten-free diet.
Awesome. Thank you, Mallory, for sharing that. And if anybody has any questions for Mallory, you can also pop that in the Q&A, ask, all of our panelists questions. So appreciate you sharing that, your story, Mallory. I'm sure it's one that other people have probably experienced as well. Okay, so we are going to go through the Q&A. So I'm going to start from the beginning. Anonymous attendee asks, hi friends, will you be able to please forward afterwards link to video recording materials, slide handouts, etc.? Yes, you will get a follow-up email, and a recording will be included in that email. Hina says, I am anemic, not sure how this is connected to celiac disease. So hopefully in my presentation that was explained. So Hina, if you have any further questions about that, please let me know. I think this was asked right at the very beginning, so I suspect that we will have answered that question already. What is the, Dr. Scully, this is probably for you. What is the relationship between celiac disease and lymphoma, specifically non-Hodgkin's lymphoma?
Yeah, thank you, by the way, great presentations and very interesting. So there is a bit of an increased risk of a subtype of lymphoma in patients who have celiac and who are not on a diet. So generally, there's exceptions to everything, but generally once you're diagnosed and sticking to your diet, then that risk goes down. I'm not sure if that's what people want to know, or I'm looking.
Specifically non-Hodgkin's lymphoma. I'm not sure if that is.
It's a variant of non-Hodgkin's lymphoma. Okay. There's over 130 different types of lymphoma, and there's a specific one that's seen often in the intestine, and it's probably part of the same well, we don't know for sure, but the same autoimmune stimulus, right? That the, yeah. So,
Okay. Anne-Marie asks, wondering about high B12 serum test could indicate in a 15-year-old celiac patient who adheres to a strict gluten-free diet. I guess they had high B12. And if that is related at all to a strict gluten-free diet.
Not generally. Well, it probably does need to be monitored to try and see. Sorry, I'll be right back. Sorry about that. I have a timer on my computer to try and stop me staying up all night. So it goes off around 9. But anyway, so yeah, the high B12 is probably worth just checking out again and trying to see, is the person taking any B12? Might be taking it in supplements or something as well, right?
Yeah, that's what I was wondering as well.
Yeah.
Okay, Jules asks, why does my blood always show low hemoglobin and pale red blood cells? Iron level is usually okay.
Well, it would depend what people mean by okay, right? Do you know because the serum iron can be measured, or the ferritin, which measures the stores. So there are many different causes of anemia, many different. So that is one issue, that people can have more than one cause of an anemia. And they could have iron deficiency and something else. But with regards, it is very important to realize that the hemoglobin levels and the changes in the hemoglobin in a blood count come quite late. They usually only come when you've got virtually no iron left. So you can really quickly go downhill after that when you've used all the stores. So it's very important to get your physicians to get your ferritin levels measured. And then with ferritin, it is a factor. It's called an acute phase reactant. So if it's low, that's clear. But it is possible to have a normal ferritin that has been pushed. So for example, if you'd had COVID or a bad infection, that can cause your ferritin to be artificially raised. So yeah, there's a lot to the testing and the interpretation. If your ferritin is low, that's clear cut, that's iron deficiency and that's it. But if it's normal and you've anemia or other things, you know, perhaps something else has given you an artificial boost in your ferritin. Yeah.
Okay, interesting. Kayla asks, I'm confused. Are there different types of anemia besides iron deficiency and anemia?
Yes, there are hundreds of different types of anemia, because our red blood cells are very important.
Yeah. Maybe pernicious anemia, and low folate.
Well, for anemia, there are basically a couple of different groups. So most of us don't thank our bone marrows enough, but our bone marrows are very active organs that are producing trillions of cells every day. And so there could be some problem within the bone marrow, and there are a lot of genetic causes of anemia. There's thalassemia, hemoglobin, all sorts of genetic causes of anemia. And then there could be an acquired damage to the bone marrow causing anemia. And then you need the building blocks to make those red blood cells. Iron is very important, B12, protein, they're all important to make those red blood cells. And then something could be causing the red cells to be broken down more quickly than usual, and that can cause anemia. So there's a lot of different causes. Yeah.
Joan Crocker says, not a question, but just want to say hi to Dr. Scully. She diagnosed my baby girl, Darian Hoyt, with rhabdomyosarcoma in January of 1997, and I remember her well.
Nice to say hello. Thank you.
And Tanya says, how can I feel better with chronic anemia? I'm tired all the time, no matter how much I sleep.
Yeah, a lot of people, well, this whole area is fascinating because it's so variable. I have met people who have low ferritin. So there may be other pathways. So there are some people with low ferritin who are not symptomatic, but most people, who say they're not fatigued, but most people are. And then most people with anemia are. So if at all possible, depends what the circumstances, but we really need to try and sort your anemia if you're tired. Yeah.
So is there anything other than just increasing? I guess, Tanya, the other thing would be is how are you diagnosed celiac, and have you gone on the gluten-free diet, and how long into the diet are you? Because once those villi start to regenerate, so we think about, your villi are blunted down, the mucosal damage from that one screen, as it replenishes and as they grow again, you're going to be absorbing your nutrients again. So hopefully with that nutrient reabsorption and your iron levels will come up, that fatigue should hopefully alleviate.
Yeah, but I would say for people who, there's somebody there who has a hemoglobin of 100 and a ferritin of 3. So there are pros and cons to everything, but if you're very fatigued, very symptomatic, and you really have anemia and a very low ferritin, then, there can be a discussion about giving an iron infusion to get the levels up more quickly. And there are certain risks to that. If you've got time to go on your diet and so on. But if people are very symptomatic, then sometimes an iron infusion is the way to go. Yeah.
Okay, super. There might be some questions about that, I imagine. Okay, what is the difference between ferritin and, I guess, serum iron in blood work?
Yeah, so serum iron is measuring the amount of iron in the bloodstream, and there's a lot of different things that would affect that, whereas ferritin is an indirect measure of iron stores. And as I mentioned, for most of us, it's a useful measure. There are probably other systems, so there may be subgroups of us who have another thing other than ferritin, but for most people, it's a way of measuring, an indirect way of measuring iron stores. So the ferritin being low tells you that your iron stores are low. And that's particularly important for mothers for pregnancy, because the way we're designed when we are pregnant, the placenta is going to push all the iron to the baby because the baby really needs the iron. So so it's really important for our mothers to and particularly if you're pregnant and anemic, I really recommend and there's no contraindication, IV iron, because it's very good for both the mother and the baby. And having a baby is tiring anyway, so you don't want to be tired, and you don't want to have your baby really needs the iron. So yeah.
Okay, anonymous attendee asks, I was told my iron levels are low, but my nurse practitioner said something about my blood is still able to carry a high level of oxygen. So she said that my blood has adapted to being low and still being able to do its job. What does this mean?
I don't know. Well, basically, if we have developed anemia over time, the other cause of anemia, by the way, is blood loss. So, if you have an accident or surgery or something and lose a lot of blood. So if you develop anemia over a short period of time, which can happen, then you tend to have more symptoms, because if it happens slowly, you may adjust a bit, right? So, but in general, because iron deficiency is so common in babies and girls and women, for a long time, people argued it was normal. And that's one of the problems with population health, if you like, because so many girls and women had low iron. It was just considered normal. So all these girls and women were exhausted, and it was just normal. So there was a really big debate to get to this 30 number for women, to say that below 30 is abnormal. And the evidence that fatigue starts for many people once you become anemic is very clear, but there are also less smaller studies, so they're not as accepted, but there are studies showing that for some, like for somebody studying engineering or somebody, you really have to think, it's probably better to have your ferritin between 50 and 100. There are some studies showing that mild iron can affect neurocognitive function.
Oh, wow.
Yeah, that's not nearly as agreed upon, but there are published data in that area. But they were small studies, whereas other studies are much more. So I really like to see ferritin levels between 50 and 100. So you've got a bit of a reserve. That's what I think is good. The other thing I would say for the so any girl or woman who's menstruating is that, again, it's old data, it's not so well known, but there is an enzyme in platelets called cyclooxygenase, which probably performs better when you've good iron stores. So one of the things that can happen to girls and women with their periods is when they have periods, they become iron deficient, and then the periods get worse and they're losing more iron, and they're in this sort of vicious cycle. Sometimes just by really correcting the iron, you can really, there are other things that may need help with, but it's very important for people who are menstruating, I think, to have good iron stores, and that would sometimes really make the periods much better. Yeah.
Interesting. I've been following a group on Facebook called Iron Protocol. They have recommended heme iron. Do you know what is the proper dose? They recommended weight in kilograms times 1.5 to weight in kilograms times 2 as the range.
Okay. Did they mean it in a tab? Where are we asking about this? In the tablet? Are they talking about?
Yeah, I'm wondering.
Yeah,
that's quite a high.
Yeah. I'm not sure.
Lindsay, if you want to add, maybe be a bit more specific about that, that would be super, and we can maybe get to that.
Yeah. The other thing I would say is with the iron supplements, ferroheme is very popular. It's the one that's most prescribed because a lot of people have a lot of trouble with iron. They find it difficult to take iron supplements, and ferroheme can be easier to take, but also a number of people don't absorb well with it. So there are a number of different supplements. There's ferroheme, but there's also ferrous sulfate, ferrous gluconate, ferrous fumarate. And it's quite interesting that I find some of my patients respond to one of those differently. So I think it's worth changing around and seeing which iron supplement.
So for somebody, sorry, go ahead.
No, good. Sorry.
I was just going to say, so for somebody with a low hemoglobin or a low ferritin, what would you suggest as a hematologist as a good dose for repletion? And this is for an adult.
Well, so it would depend on the context. If somebody's very symptomatic, if they're tired and they've hair loss and they're miserable and their ferritin is low and their hemoglobin is low, I will generally see if they would like intravenous iron.
Okay.
In those circumstances. If they're not that symptomatic, and some people don't want the intravenous iron, and there's pros and cons to it, but somebody who is anemic and iron deficient and miserable, I would offer the IV iron as a start, to try and get it replete, and then try to see through diet and everything else, can we keep it up? Hopefully we're not going to keep doing the IV iron, right? So that's
would 300, like for an oral dose,
yes.
With 300 a day, or would you say 300 twice a day, or what would be
no 300? I think 300 once a day is good. And there was a study published a few years ago suggesting 300 every second day was better because it changed the ratio of some of the absorbatory factors. But that was a small study, and I tried it with a lot of patients. We didn't find it make a difference. So I go with the 300. And then there is a product called Florivent, which is like a syrup made with rosehip and different things. And it contains ferrous sulfate. But some of my patients like that. They find it easier to tolerate. Yeah.
Is the sulfate versus the fumarate versus the gluconate, is the sulfate the most bioavailable?
there's a debate about that as well. Ferrous sulfate is kind of the older iron, and actually I didn't use it at all for a while, and then I went back to trying it, and I had some people who did very well in it, right? So I really find, usually what I do is, when I'm giving people iron, is I write a prescription for one iron for 1 week, and for a different one for the second week, because if they're miserable on the first one, I'll try another one the second week, and go through a couple of them to see if it makes a difference. There are some people who just have really trouble taking any iron, but I really find it makes that some people can, don't respond to one but respond to another. Yeah.
Okay.
Sorry.
And when you say people have difficulty taking iron, are you talking about the constipation, possible nausea, GI upset, that sort of thing?
All the gastrointestinal misery. Yeah. Yeah.
Okay. Sharon asks, does iron deficiency anemia cause tingly feet and legs in undiagnosed celiac? And if so, how long before going on a gluten-free diet does it go away? Or after going on a gluten-free diet, excuse me.
Well, definitely people can have restless legs and all sorts of symptoms like that. Again, I don't know, because for me, if people have severe sickness, if they're symptomatic, anemic, and have really low iron, I will always offer them IV iron to try it. And I find not always, but very often, people notice a huge difference, and very quickly. So, but I think it's a combination of everything: the diet, everything that will help. Yeah.
Okay, anonymous attendee says, I've been anemic on and off for years. I found that since developing celiac disease, supplements I used to tolerate cause severe bloating, constipation, etc. Can you recommend an iron supplement that is easiest on the GI tract?
Yeah, that is quite a problem. Like, there are people who really, have trouble with iron, and some of there is, not most, but there are, that's what I mostly see is patients who have trouble. So I have patients that I give IV, smaller doses of IV iron to once or twice a year, because they're just miserable with any iron. But that's usually, well, it depends. Again, if they're very symptomatic and they're anemic and so on, I'll give them the IV iron. But otherwise, if they're not symptomatic or they're not anemic, we'll try different ones before going to, but some people just cannot tolerate iron. Yeah. Not most can, but some people, they have misery.
For someone with low ferritin, but a normal hemoglobin, but they're symptomatic, would you ever consider an iron infusion?
Yes, if they're symptomatic, and some people are that, I saw a gentleman, for example, a couple of years ago, and he was sent to me with a normal hemoglobin and a ferritin of 10, and he had no symptoms at all. So I said, and he had been checked out by a gastroenterologist. He was sent to me after having been screened for celiac and any gastrointestinal problems and so on. So that's what I'm saying. There probably are other enzyme systems. He knows, he had loads of energy. He was fine. So it's very variable. But some people I find, like, I have people I've followed for years, and they're able to tell me once their ferritin goes below 50. They're calling me up.
Okay, Aaliyah asks, hello, Aaliyah. Is there a study regarding the number of celiacs that are taking iron pills based on doctor recommendation? I was diagnosed 10 years ago. My TTG numbers are going down, but I still need to buy Ferromax iron pills.
That's a good question, but I don't know the answer to it, but I'm sure the answer exists. But Ferromax, you see, now you have to see, I have an unusual patient population, because I see a lot of people with problems with iron, but I see lots of people who are on Ferromax and don't respond to it, and sometimes respond to ferrous sulfate or ferrous gluconate. Yeah.
Okay, interesting. So when somebody comes to their GP and is told they have low iron, When should they get their first follow-up blood test to see if it's working? Because if Ferromax may not work for some people and they go on it thinking this is going to be their solution, what should somebody do?
That's a good question. And again, it depends how low and so on. But I generally, anybody I'm putting on iron, I usually see back in a month. And as I said, I often give them a script with more than one iron, more than one type of iron. And we go over it, like if you're really miserable after a week, let's try this one and so on, right? But I usually will check. If somebody there came in with a hemoglobin of 38, I was reading, which is really low, and must have been miserable. But the somebody's that low, I will check what they know. It takes 5 days to see a response to getting the iron.
That was my next question.
Yeah.
That was my next question. How long until you see a difference?
Okay, so if somebody had a hemoglobin 38, I'd be checking. There was some, I'd be really worried. Yeah.
Okay. Chris says, I was originally diagnosed with celiac disease in 1991 through blood test and biopsy. I followed a gluten-free diet for 18 months, then was told on a follow-up that I likely didn't have celiac disease, that it was my IBS. I was re-diagnosed in 2014 and told my numbers were through the roof. I remained gluten-free since then. My concern is that my iron levels have remained extremely low most of my life, but none of the doctors I have seen seem to be concerned about it.
Unfortunately, that is an issue. A lot, I had one patient once, this is years ago, this poor woman, she actually had fibroids. She had an abnormality with her uterus, so she did very heavy periods, so she's very iron deficient, not celiac. But when I saw her, she had seen 6 other doctors. She had seen a heart specialist because just like Mallory, she had, fast heart rate. So the heart specialist saw her, diagnosed her with iron deficiency anemia, but didn't treat it. She also was short of breath. She saw a lung specialist, all men. Anyway, she saw a lung specialist who, I shouldn't have said that, terrible. But anyway, she saw a lung specialist who diagnosed iron deficiency anemia and didn't treat her. She saw a neurologist for dizziness. She saw a psychiatrist for anxiety. So that poor woman saw. Then she finally saw a man who was a gynecologist. He was very concerned about her, and he got involved with me. And anyway, she had all sorts of problems. But a lot of people don't, they will if you're anemic. But a lot of people, as I said, it's not like the guidelines say for sure if you're, and that was a fight for most of my medical career. It was a fight, like, because they were all saying, oh no, that's normal, right? So ferritin of 2 is normal, right? So so a lot of people, that I guess they haven't had the fatigue themselves.
Yes, exactly. Yes.
So well, and it's part of the thing too, that it's, fatigue is not going to kill it. Most people sort of worry about something life-threatening. So
quality of life.
Oh yes, I agree. So I agree. That's what I spend a lot of time on. Anyway.
Very interesting. So that was the next person, Hina. What do you mean if your iron was 1? How serious is that?
The ferritin of 1. Well, it's not, as I said, it's not life-threatening is the thing, but I find many people with the ferritin of 1 are miserable. They're miserable. So
absolutely.
Their quality of life is very affected. Yeah.
Yeah, absolutely. The second part of that was, can it lead to celiac disease? And no, Dr. Scully, I'll just jump in and answer that one. Low iron doesn't cause celiac disease, but people with iron deficiency anemia are a higher risk population of being undiagnosed. So we want to make sure that we screen that population, but it's certainly not a cause of. Correlation and cause are 2 different things, and there's just a correlation with that population. Okay, is blood work the only way to know if somebody is anemic?
Yes.
Okay. So that old wives' tale of look under your eye.
Well,
and
you
see
can,
if
you know, but
it's-
also some of that will depend on your coloring, right?
Right.
Yeah, but
Okay, very good point.
but there is a thing, and then of course, like too, depending on, you know, on your skin tone and whether it's summer or winter. So somebody with nice pigmented skin, well, that's another thing. People who have lots of pigment in their skin may not show anemia, right? So that's especially important. You know, if people are already, but the classic thing with children was, you know, that the grandmother would come visit, you know, maybe they hadn't seen them for months, and they'd come to the child and they'd say, "Oh, that child's really pale," and the parents, but the parents have been looking at the child every day, so it's not as noticeable. So that's
absolutely. Is there a relationship between low iron or anemia and increased anxiety or depression?
That's a good question, but I think if you're feeling miserable all the time and everybody's ignoring you, that's enough to make you anxious and depressed. But anyway, well, I mean, this poor lady who had that, she had shortness of breath, you know, if you have all these symptoms and you're not able to function, I'm not a psychiatrist, but I think that's going to make most of us anxious, right? And then if you're not listened to, and people are just like, "Oh, you're just tired." I think it, anyway. But I don't know if there's proof of all that. There may be other factors, of course, but yeah.
Okay. Tanya is asking, can we pressure companies to fortify gluten-free food? So Tanya, I'll ask you to please write to your MP. And do ask for that. The CCA has had a meeting with Health Canada to bring it to the table, and we are advocating on your behalf to try and get this ball rolling. I'll tell you, it does seem like a really steep climb. So any support that we can get from our fellow Canadians to write those letters. And Melissa, is it the MPs that they should be writing to? Can I just ask you to verify that for me? If you're still on.
I am still on, sorry.
Okay. Thank you.
So if people are interested in the Ontario blood testing issue, is that what the question?
No, it was for fortification of iron and food. So who would they write to? Is it their MP they would write to say that this is an issue that they would like to see Health Canada address?
Yes. So that'd be federal, and yes, definitely. Sorry.
Okay, thank you so much. I just wanted to make sure I told them the right information.
No
Thank
problem.
you. So thank you, Tanya. Please do write your letter. Anybody else on tonight we've got 175 people here tonight. So, for our children who have celiac disease, who aren't getting access to the same amount of iron, in the winter months when fresh fruit and vegetables are expensive and our kids aren't necessarily wanting to eat lentils and chickpeas and hummus and mussels and all that kind of stuff, it's in my estimation, it's a bit of a human rights issue that our kids are being, what's the word I'm looking for? They're being discriminated against. Yeah,
I didn't realize that, and I'm shocked. Actually, really horrified.
Yeah, it's really terrible that we can, like our family, because my daughter and my husband are celiac, we all eat gluten-free. So both of my daughters, my youngest daughter hasn't had her iron levels tested, but both my other daughters have low ferritin.
Yeah. What we could do, Nicole, is we can consider maybe a petition, so we can look into that for the federal government. I think they actually do online petitions, so that is a possible opportunity to have our voices.
Actually, I do a lot of advocacy, and it's really easy in Canada. You can get every single, and quite a few will reply to, and you can write to the Prime Minister as well, right? So there's a lot of avenues, and if 100 people do it, I'm telling you, there will be, and also that's a lot easier than like I'm writing to them about climate change. It's much harder. So I think you should, that I'm really shocked about that, because to me that can't be that difficult to fix. Obviously it's not being fixed, but I'm just saying.
Well, there's an easy solution, isn't there? There's not a difficult solution.
Well, I don't know enough about the processing but I would think if you can do it for the other flours, why not? Like,
yeah, and it's mandatory for the other flour. So thank you, Tanya, for asking that. Okay, next question, Becky. You mentioned that iron fortification is no longer required. Are you aware of how this came about and why? So Becky, iron fortification is not required for gluten-free products. It is required for gluten-containing products. So maybe I spoke quickly and it sounded like no longer required, but it never was required for gluten-free products. It is a voluntary choice for those companies. And as you could see in that one example, it was the same company. Their regular flour was fortified, their gluten-free version was not fortified. So,
strange,
and it's,
isn't it? Like,
it's a cost issue, I think, at the end of the day, but it's the trickle-down effect, because then when everything's made with that flour, we are also not getting the fortification in any of those packaged goods. So
okay.
it is a really, really big problem. Okay, Teddy asks, oh, and I always have a hard time with this word. Is it Kirkin, right? Kirkin? Gluten-free package mixes use enriched gluten-free flour. Thank you, Teddy, for that, and tasted good too. Okay, I will look at those. Those are those Nova Scotia or those PEI? They're made in the Maritimes somewhere. And I can't remember which province it was, but it's one of those, I think. Fantastic. Thank you for bringing that to our attention. What was your lowest iron level? So maybe what is the lowest iron level possible, I guess is the question.
Well, the ferritin can go down to 0 and 1. I don't know if I've seen 0. Yeah, well, around 1 is 0 and 1 is very low for the ferritin. Yeah.
Okay, and I am very aware of our time, everybody. So it is 5 o'clock and we did have an hour session. So we are done with our presentation. So if anybody did have somewhere to go, absolutely, please feel free to sign off. We'll maybe take 5 more minutes to take a couple more questions. Dr. Scully and Mallory, is that okay? And then we'll sign off. So let me go through here, see if we can ask some more some questions that haven't been asked before. Lorna asked, can you be diagnosed with celiac disease at any age? It's a quick one for me to answer. Yes, you can. We start screening high-risk children at 3 years old. If your child has symptoms before they're 3, then they will get screened as well. But sometimes the TTG isn't an accurate number before 3, so children might have to go under an endoscopy if it's seeming much more serious. And the oldest person ever diagnosed with celiac disease was 101. So anywhere on the lifespan, you can be diagnosed with celiac disease. So
Okay.
there's that one. Yes, go ahead, Dr.
Yeah. So anyway, thank you to the people who say they were validated, because you should be. Anyway, I really believe this stuff. But to the person who asked about the optimal levels, so the agreed level of ferritin is, right now it is agreed that below 30 is abnormal in adults and in girls and men and women. But after that, a lot of people say, oh, if your level is 31, it's fine. Personally, I like to have my patients' level somewhere between 50 and 100. Now, I have some patients who think it's better over 100, and after that, I don't know, and I don't want to be sort of getting into any sort of trouble. But and I don't usually order IV iron unless the ferritin is below 50, because again, with use of resources and so on. But I have people who feel much better when their ferritin is like 70 or 100 or something around that. Yeah.
Okay. So you've answered that. I'm going through things that you might have answered. Is there a relationship between having celiac disease and blood clots causing ischemic strokes? Do you have any information on that?
No, I can look it up, but I'm not aware of that.
Yeah. I am not either.
Severe iron deficiency can put people at risk of a stroke. Yeah.
Okay. Oh, interesting.
Celiac disease. Severe. Yeah. Okay. Before you get too frightened. Yeah. Yeah.
Krista asked, is celiac disease hereditary? Yes, it is a genetically predisposed autoimmune disease. And Mallory, do you want to share anything about that?
Yeah, I was just gonna say, I guess, as I mentioned earlier, I tested positive for celiac disease, and And then my whole family had to get tested. My mom and my sister both tested negative, but my dad tested positive. And then we actually all got our like a 23andMe screening done, and turns out we all have different combinations of genes. And I think Nicole has mentioned that different combinations of genetics can put you at a slightly higher or slightly lower risk. So yeah, it is hereditary, definitely. My dad has no symptoms, but he does have the genes, and he has celiac disease.
Yeah,
Wow.
about 40% of people carry the gene for celiac disease, and about 1% of people express that gene. What causes the gene expression, is being looked at. Some of the really interesting treatments that they're looking at to future medications for celiac disease are vaccinations for viruses that they think might be a trigger for celiac disease, which is super exciting. So vaccines might, for rotavirus and that kind of thing, if that could be a possible trigger for celiac disease, if we catch that before it happens, then we might prevent the expression of that gene. So really exciting information or research going on. Okay, thank you so much, everybody. I think we're going to have to stop here. There's so many questions, and I could keep going, but I will say thank you because I'm aware of everybody's time. And I'm so grateful that Mallory and Dr. Scully, that you guys came and joined us tonight and shared your expertise and shared your stories. Thank you, everybody, for coming. Please look towards our next webinar Wednesday.
Don't forget your winner.
Next one. Oh, thank you. We have our winner for our $50 SHAR giveaway, and it is Mary from Mississauga. Yay, Mary. So somebody will be in contact with you. I believe it's coming directly from SHAR. So you will get your prize. Very exciting. $50 of SHAR giveaway. That's fantastic. So thank you, everybody, for coming. I hope everybody has a wonderful evening and a safe and enjoyable long weekend.
Thank you.
Okay, bye for now.
Thanks, everybody. Thank you. Nice to meet you, Mallory. Thank you.
Thank you.